Ventilator Mastery Series, episode number 5. Septic shock with respiratory failure, ventilating the metabolic storm. Septic shock is not just hypotension with infection. It is a systemic inflammatory state that causes vasodilation, capillary leak, mitochondrial dysfunction, and often secondary lung injury. Many of these patients develop an ARDS-like picture due to inflammatory alveolar damage, while simultaneously suffering from severe metabolic acidosis due to lactic acid accumulation. The ventilator challenge is in septic shock is twofold. First, the lungs may be stiff or edematous, requiring lung protective ventilation. Second, the body has a metabolic demand and is compensating for metabolic acidosis by increasing respiratory rate. If we blunt that compensation without replacing it appropriately on the ventilator, pH will crash. The ventilator strategy depends on whether ARDS physiology is present. If compliance is reduced and oxygenation is poor, tidal volume should be set at 6 ml per kg of ideal body weight with plateau pressure maintained below 30 centimeter of water. PEEP should be individualized based on oxygenation and hemodynamics. Driving pressure should ideally be below 15. Respiratory rate must be adjusted carefully. Septic patients often require higher minute ventilation to compensate for metabolic acidosis, while lung protection is important. Underventilating these patients can worsen the acidemia. The goal is to maintain a tolerable pH, usually above 7.20 to 7.25, while still protecting the lungs. Hemodynamics are critical. Positive pressure ventilation reduces venous return and can worsen the hypotension in already vasodilated patients. Adequate volume resuscitation and vasopressor support should be optimized before and after the intubation to prevent cardiovascular collapse. The common mistake in septic shock is focusing only on oxygenation and ignoring acid-base compensation. In these patients, ventilation is not just about the oxygen delivery. It is about maintaining the physiologic balance in the middle of a metabolic storm.